Hi, Kang. Thanks for joining me tonight. Really appreciate it.
Hey Donna.
Well, I wanted to start off by having you introduce yourself. As you know, what we're doing is a few little interviews with our co-organizers of Music Medicine Machines. So I want our members to get to know you a little bit better. So could you start
Sure,
at the beginning? Start at birth.
sure.
I'm just kidding. You start wherever you want to start.
My name is Khang Vuong. I am the founder and CEO of Mira or Mira Health. We are an organization helping the uninsured and underinsured access affordable health care, which is really needed right now in this time. I started my career about a little bit over 10 years ago, working in a very small emergency department in Chattanooga, Tennessee. I was paid $7.25.
Wow.
And I was a pre-med, um, working my way up to medical school and then ultimately decide to do a little pivot to the management side of healthcare. Went to George Washington University at the School of Public Health, and then I went to work for another health system, which I climbed a ladder to report up to the system CFO and CEO, and then um, late 2018, early 19, I founded Mira.
Why Mira? Tell us why you started your own business.
Yeah,
Why did you go that route? I know firsthand how tough it can be.
mhm. I think starting a business is not the easiest thing ever. It's not also um, in terms of earning, it's not the best route, especially in the first couple year if you want to make a lot of money. Like starting a business is not one of them. However, I think I have been always a little bit frustrated with healthcare, and I think it's a good thing because when you're frustrated, typically you are seeing things that you want to improve. Um, and I saw many things in healthcare I want to improve, but finally I found one that I was really passionate about, and that if I'm not doing this, I couldn't sleep at night. And so it felt like an obligation to do. Um, so I didn't, in a sense, I have choices, but I didn't.
Well, what do you love the most about being the founder and CEO of Mira?
Yeah, I think what I love the most is that I'm actually not the boss in the company.
Tell me
Um,
more. Tell me more about that.
because we have a small team of six, soon to be seven. But as the CEO, you learn very quickly that number one, you are actually in a startup, you have to do the work, but also you not delegating, but you're asking other people to do part of your work, increasingly more and more and more. And so, but people, especially in the size of a company, you need a lot of leading by influencing. And so almost you have to convince people to do certain things. And so all of a sudden, when you come in, you thought, oh, I'm the boss. You're going to have a very tough time. You're going to very quickly learn that, oh, you really have to lead people by convincing them. And I think it's very interesting. And actually, I love that the most because it's very different.
What has surprised you the most? Like, what was something you didn't expect when you started your business?
Yeah, I think one thing I was really surprised about, I sort of really love until this day, is that um, I'm a reader. I read a lot of books and articles, and I write. But then when you work in a big company, you have those knowledge, but you didn't really have a place to apply them. You kind of do, but not as much as you like to. Now being in the thick and thin, I get to apply a lot of the knowledge that I learned. and I can see the result immediately.
Now, I've seen one of the results. I know that Mira launched a solution specific to COVID. Can you tell our audience a little bit about that? And you're in New York, so I'd love to hear your thoughts around this, what you launched and the environment there in New York.
Yeah, so it started actually early January when I remember Wuhan only had less than 20,000 cases, which is a fraction of what we have today in New York City. But we had a team meeting with our marketing person, and we were looking at different trends to we like to be ahead of the trend, not a year, but about 3 weeks. So we think that's the right timing. So we were talking about what do we do on a marketing point of view. And I was like, well, we should write an article about um, how to get tested for coronavirus COVID-19 in New York City. And we wrote that article, and about a week later, I woke up one morning, and typically we get a few thousand user every day, but I saw 4,000 people
Wow.
the first day, and it was only 9 a.m. in the morning. So I was like, this is really weird. And I talked to our engineer, like somebody's hacking us, like what's going on? And I realized that, oh, actually, that article was the one that generated so much traffic. And because the data is so early, it's not even showing up on Google Trend. It's not showing up on any like the SEO analytics website out there. And so right then
Mhm.
and there, and coronavirus wasn't a big thing in not
Yeah.
even in New York or the United States early January. But the fact that people were searching for those terms and what's concerning, so it started there, like users' interest. And then we were looking at about mid-February, we were looking at the landscape and so on, like what can we do as a company? We found two things. First, there's so many companies out there that are pioneering testing solution and so on. There are multitudes of chatbots. But second point, one thing that was really missing is that the connector between all of those. So if you're a patient, you can go to this company for the assessment, and then they tell you to contact your healthcare provider, and then you want to get tested at another site. So the patient's always wondering what's next. So long
Right.
story short, we think our role within this pandemic is to be a platform where the user can start with the assessment and end with a test, or a virtual care option where they don't have to be left in a vacuum and wondering, oh my god, what's next. Um, so fast forward, we are now seeing roughly over 500,000 people going to our platform every week, and about 1 to 2 thousand
Incredible.
going through the assessment a day.
Wow. Are
Um,
they just New Yorkers or nationwide, or what are you
Actually,
seeing?
globally,
Globally.
yeah,
Wow.
we have
Oh,
visitor almost in every single countries.
well, that's incredible.
Yeah,
But
but 90% is from New York, 90% is from the US and Canada.
okay, gotcha. But you're not able to connect those users to providers though at the end of the assessment,
Yeah,
correct?
so
Overseas.
unfortunately not, um, because obviously that's one, it takes a massive database,
Right.
tremendous amount of research, which we don't have the resource to do. Um, but I think even just in the United States, specifically in New York, we're able to, for the few thousand people who are going through our platform per day, we really help them to be educated and understand that if you have mild or moderate symptoms, you don't have to go to the emergency room, which saved the hospital a few thousand people
Right.
who are not showing up and clogging up their whole system.
I mean, for sure, seeing all those global users proves the need, right, for
Right.
a platform that can help people, can assist people in getting that education and getting tested. that that's a
right,
worldwide problem right now.
right. And I think it started with that moment back in January when we were discovering and talking about that trend, and we were able to act on it very quickly and harvest those interests so quick that we realize, oh my God, this is going to be big.
Yeah. I mean, more important, I feel personally, why
Right,
I love what Mira is doing is the affordable health care. That's
right.
going to insurance and such, because that's going to be even more important now because, as you and I both know, the economic impact of the pandemic is immense, and not many people can really afford healthcare.
Right. And, we were having a discussion with a big health plan just 2 days ago. And one of the things we were talking about, just, a mutual non-business discussion, one of the things we were talking about is like, how is health insurance going to be different 5 years from now? And right off the bat, what you're seeing today, people are actually not looking for coverage. They're looking for care.
I see. Okay. Mm-hmm. Yeah.
So we all are looking
Certainly
for
for the
health care.
pandemic. Yeah.
Exactly. We care about getting care, not getting coverage. And now people are starting to see those are two very different things. And so when 5 years from now, one thing is going to change so drastically, beside many other things, is health insurance, because
Yeah.
obviously what is being done today doesn't really serve the needs of everybody.
Right. It's amazing that you're at the front line of all of this, Kang, and I'm so
Right.
excited for you being an early business owner and founder, how tough it must be. Um, Tell us, how are you holding up? I know a lot of us are struggling with being isolated.
Hmm.
How are you personally doing?
Yeah, so I think it's tough to be in quarantine alone and also run a company and be the leader of that company, as well as
Right.
trying to fundraise, trying to get new clients, new patients to keep the lights on. I think it's really stressful. It also, in a way, it's sort of a gift, right? Because I can actually make the decision on my employment, which is a huge gift because a lot of people, they are under the mercy of somebody else, where
Mhm.
I actually can determine my employment, which is a huge gift. And on top of that, I have the power to determine employment for many people in our companies. Like not a lot, like less than 10, but so it and because I have that power, I have the power not to do things that many other company are doing, which is laying them off. Um,
Right. Mhm.
and so I think it in the uncertainty, there's like a silver lining, which is that, right? But I think I'm doing well because I realize that the magnitude of what we're dealing with, and we all still have a job, so that's great.
Right. What advice would you have for other small business founders like yourself
I would
during these
say,
times?
yeah, I would say, um, one, know that this is not permanent. It's not. It comes, it's gonna go. It may not be gone next month. It may come back, but it's not gonna be permanent. So that's one. Second is that, um, as small businesses, and I say we because we're one of them, we actually have the power to adapt and pivot much quicker than the big company. So we are
That's
actually
true.
having huge advantage over many big corporations. Just take one example. If you're looking at COVID's assessment, right? A lot of the health systems still don't have it. A few
Right.
health systems actually trying to roll it out, and we are actually 2 days past the peak in New York City. And so,
Right.
but there are many startup, beside Mira, that push out these tools like way early in February. So think about that. So as small business, we actually can pivot and agile really quick. So bullet point number three, given one and two, you got to take the opportunity and look at what's the next big thing and align yourself with that
Right.
trend instead of staying still.
Right. As they say, skate to the puck, right?
Exactly. And you can skate a lot quicker compared to the bigger guys.
Right. Yeah. Well, that's great advice. And Khang, as busy as you are, I'm super excited that you're part of the organizing team for Music, Medicine, and Machines. I'm looking forward to our members getting to know you better. Tell our audience real quick where we could find Mira on the internet.
Sure, you can either Google us, Mira Health or Mira, or you can go to our website at www.talktomira.com.
Awesome. Okay. Thanks so much, Khang. I will see you soon.
Thanks, guys.